When I had Lyme disease about 20 years ago, I had a lot of trouble, first of all, getting a diagnosis, because that was pretty iffy 20 years ago, and it's easier now to get a good diagnosis. I started taking OSHA root, and it would displace the symptoms, but only temporarily, and then I'd get them back in a few weeks. And I learned that I had to use the Chinese protocol, which I learned from a naturopathic physician in Colorado who turned me on to 3 Chinese herbs. That's what I took eventually to get rid of Lyme disease. The OSHA root, I now know, can also work on Lyme disease in combination with another herb, and I'll talk about that in a minute. But the secret to both of these protocols is that you need to take them for a long period of time. And what I was doing wrong was taking OSHA root just until the symptoms went away, and then I would quit. That doesn't work for Lyme. You've got to keep taking it for at least 6 weeks until you're sure that you have killed off all of the spirochete and co-infection organisms that are associated with Lyme. The Chinese remedy, which came from one Chinese doctor in Connecticut, and it involves 3 Chinese herbs. The first one is called Japanese knotweed, which is Polygonum cuspidatum, and that is a fairly common standard anti-parasite medicine in Chinese medicine, Japanese knotweed. That's number 1. Number 2 is an herb called sweet wormwood, which is Artemisia annua, and that's also a very common Chinese herbal medicine, often used for parasites and many other things. But in this case, it's used for the co-infections that go along with borreliosis, which is Lyme disease. The third compound is in a plant called Andrographis spp. Those are 3 very common Chinese herbs in herbal medicine, and they are taken 1 gram each. Artemisia annua, which is sweet wormwood, can go up to 2 grams per day. So you're taking 1 gram, and then 2 grams of the sweet wormwood. Those things in Chinese medicine come in a powder form, and you can dissolve them in water. I took them before breakfast, and that's an easy way to take them. They're a little bit bitter at first. Then you could wash it down with something like a cup of coffee or tea, or your breakfast right after that. Once a day. You can also add something to it that I added to it on the advice of some other naturopathic practitioners, and these are commonly used for Lyme disease. One is cat's claw, which is a South American herb that's anti-inflammatory, and the other is Lyme nosode, which is a homeopathic medicine. Now, I've seen people just use the 3 Chinese herbs successfully without taking the cat's claw or nosode, Lyme nosode. The Chinese protocol, the way I took it, was for 1 year. I took it for 1 year without any recurrence of symptoms, but I did have a Herxheimer reaction, which you can have with Lyme disease. So Lyme disease is fairly well known for having Herxheimer reactions, which is when you're killing the Borrelia organism and they die in large numbers, the thinking is that the toxin that Borrelia carries is released immediately into your bloodstream when those organisms begin to flourish and then die due to the drug you're taking, the plant medicine. And when that happens, you get a recurrence of some of the symptoms that's very temporary. It may last for 10 minutes, could last for several days. But that doesn't mean that you're reinfected if you're still taking the plant medicines. It just means you've killed off some of the organism, and the Herxheimer reaction is just your body's reaction, inflammatory reaction to a die-off of the Borrelia organism. So you must take it for at least 1 year, according to the best advice of the people who use this remedy. And I took it for 2 years just to be certain, because I did not want to have Lyme disease come back. So some people take it for that long. It's a very inexpensive combination of plant medicines. I don't know what the current cost is. I think it cost me about $50 for a year's supply. And if you have Lyme disease, that's a really good investment. So that's what I've seen people do that seems to be successful around, I'd say, better than half of the time, so around 60% of the time. And that's a fairly significant number, because by the time people try those remedies, usually they've tried all the standard medicines first, or at least the main standard medicine if you go into a clinic with Lyme disease, which is doxycycline. So if you take doxycycline and you get no effect with Lyme disease, you might want to try one or two of these protocols. There's a fairly high success rate with the Chinese protocol and a fairly high success rate with the next protocol, which is the Native American one. And that involves two herbs. The first one is Osha, O-S-H-A with an accent on the A. That's a very common antiviral and antibacterial root that is a plant in the Apiaceae family, which is the carrot family, and that one is called Ligusticum porteri. You could buy it though in most herb stores as Osha. It comes as a tincture, and you take about 30 drops 3 times a day of that tincture. Readily available, Osha. The other herb you take with that is, again, an Artemisia, a close relative of the sweet wormwood in the Chinese protocol. And this one is fringed sage, which is an American sage wort. And sage worts are just non-woody members of the sagebrush group called Artemisia. So this one is Artemisia frigida. And sometimes people hear me say it wrong, and it's fringed sage, as sorry, with a fringe on top. Sometimes people think I'm saying French sage, but it's fringed sage, Artemisia frigida. And that also can be taken at the same dose of 20 to 30 drops 3 times a day. That's an alcohol tincture. If you don't like it as an alcohol tincture, you can evaporate the alcohol and then take that with honey. The dose is 30 drops of the Osha 3 times a day, and 20 to 30 drops of the fringed sage 3 times a day. And I think the main rationale for adding the fringed sage is that one works fairly well on blood parasites. And one of the co-infections that comes along with Lyme disease often, and in my experience most of the time, is a bacterial infection called Babesia. So babesiosis is a blood parasite that comes along with the tick-borne infections. There are also other co-infections that can come along with a tick bite, and often do with Lyme disease, and that's probably handled with the fringed sage as well as the Osha. So the two combined work synergistically to kill these parasites. You must remember the most important thing is to not quit taking it just because the symptoms go away. You must keep taking it at least 6 weeks in order to prevent a reinfection.